today we are going to see epistatics. Okay, for this epistatics, before going on the proper topic, first of all you should be thorough with the anatomy of the nasal septum or the lateral wall. Okay, I mean anatomy of the nose, you should be thorough. So already I have explained anatomy of the nose. Okay, in the two videos already I have explained. So before going on the topic proper epistatic, I would like to ask one question from you guys. Okay, so please answer it. Okay, and you have only 1 minute. You having only 1 minute. Okay, and within 1 minute you have to answer me. Okay, your question is nasal septum. I'm talking about nasal septum, right? So nasal septum is supplied by, you having only 1 minute. Okay, and you have to tell me whether your answer is right or wrong. Okay, in the comment section. Okay, so nasal septum is it's supplied by, first option is the mainly by external carotid artery. Okay, A option. In B option, mainly by internal carotid artery. In the C option, only by external carotid artery, and D option is the only by internal carotid artery. Okay, so why, see, this question is a very important. Okay, you have only 1 minute. Okay, your time has started, right? So now within 1 minute you have to give me the answers. Okay, don't see there. Okay, or if you want then you see there. Okay, I don't mind it, right? So you have to answer me. Nasal septum is supplied by mainly by external carotid artery, mainly by internal carotid artery, only by external carotid artery, only by internal carotid artery. Okay, this is the questions. This is the AMS PG question. Year I forgot whether it is 13 or 14. Okay, 2013 or 14. It is AMS PG question. Okay, your time has over. Okay, now tell me, nasal septum is mainly supplied by. Correct answer is mainly by external carotid artery. Okay, very important questions. Okay, please make a note on this. Okay, why? Now you tell me. Do you know the artery supply of the nasal septum? Artery supply of the nasal septums. There is the anterior epithelial artery, posterior epithelial artery, right? There is a sphenopalatine artery. Can I tell there is one greater palatine artery also, and there is one branches from the facial artery. Okay, so this is 5. Okay, can you tell me this branches? This is anterior and posterior epithelial artery. Anterior epithelial artery and posterior epithelial artery is a branch of. Tell me. It is a branch of ophthalmic artery, right? Ophthalmic artery. Okay, and this ophthalmic artery is a branch of internal carotid artery. So it is branch of the internal carotid artery, right? Now this is septal branch of the superior labial artery, and it is a branch of the facial artery, right? And here is the maxillary artery. So this facial artery and this maxillary artery is a branch of, can I tell, external carotid artery. So total 5 branches is there. 1, 2, 3. This is the what? This is the branches of the sphenopalatine artery, right? Sphenopalatine artery. So facial artery, one branch from the facial artery, one is from the here maxillary artery gives the sphenopalatine artery and the greater palatine artery. Okay, so it's supplying here. See here, maximum part is supplied by external carotid artery. If you know the artery supply, it means there is an anterior epithelial artery and posterior epithelial artery. It means these are the branches of ophthalmic, and which is from the internal carotid artery. It means only by external carotid artery is wrong. So you know there is external internal carotid and external carotid also. So this option also wrong. Now mainly by external carotid artery or mainly by internal carotid, answer is the external carotid artery. Okay, AMS PG 2013 or 14 question. Okay, very wonderful, very classical questions. Okay, I like it. So that's why I gave you this question. Okay, so this is the artery supply of the nasal septum. This is the artery supply of the nasal septum. Can you tell me the artery supply of the lateral wall? Maximum is same. Anterior ethmoidal, posterior ethmoidal, right? Here is the branches, but here is what? Here is what superior. See here, in the lateral wall also there is the septal branches, right? But there is one specific, like this is the what upper teeth, like, so there is one superior lateral artery is also there. So, okay, so these are the artery supply of the nasal. Septal. This is what nasal septum. Okay, and this is what round part. This is the little area, right? Little area. Now this is the first question. Okay, second question is I want to tell you one second question. Okay, one more question. Okay. What do you mean by epistatics? Epistatics is, okay, first things, option A, bleeding from Little's area. Bleeding from only Little's area. Only Little's area. Option B. Bleeding from lateral wall of the nose. Or option C. Bleeding from only nasal septum. Nasal septum. And option D. Bleeding from inside the nose. Correct answer is the bleeding from the turning. Epistatic is mainly students are they have a misunderstanding or misconcept. Okay, they are thinking that epistatic means bleeding only from Little's area. That is the wrong concept, right? Yeah, bleeding from the Little's area is also the epistatics only. Okay, but bleeding from inside the nose, that is called epistatics. Okay, it may be from the Little's area or it may be from the lateral wall, right? So bleeding from inside the nose, that is the epistatics. Okay, and epistatics. Now tell me whether it is a sign or the disease. Epistatic is not a disease; it is just a sign. Okay, it's showing there is something problem. Okay, or any trauma and whatever, there is any pathology, right, in the nose. Okay, so this is only sign. Okay, not the disease, right? So you should remember. Okay, so these two questions. Okay, this question is a very classical question. Okay, so now you know little area is here. Okay, 4 arteries and everything I explained in the anatomy of the this septum. Okay, anatomy of the nasal septum. And now little area has been little area, it's over. Now one thing is that little area is a very common bleeding point in the infants and the young children. Okay, what about in the adult? In the adult, what happening? There is one vein. Okay, there is one vein that is called retrocolumnar vein. Okay, so retrocolumnar vein is running downwards. Okay, from here it's running downwards and it's past the floor. Okay, for example, here is your nose. Okay, so it's coming down. So let me make it very clear like this. Okay, and it passed the floor and it joined the venous is from the lateral wall. Okay, so this is the commonest site for the adult. In the adult, there is one. In the adult, common point is the retrocolumnar vein is runs downwards and it's past the floor and it's joined the venous drainage from the lateral wall. Okay, from there in the adult it's a very frequent point. Okay, from here bleeding is happening. Okay, one thing is the first thing is the that is the Little's area or Casselbeck's plexus. Okay, one thing is the one other thing that is called Woodruff Plexus. Okay, Woodruff Plexus. Woodruff Plexus. This is what? This is the plexus of the vein. This is the plexus of vein. Okay, so you just here is your nasal septum. Am I right? Sorry, lateral wall. This is the lateral wall. Okay, here is your superior turbinate. Here is your middle turbinate, and here is the inferior turbinate. Right? This is the exact diagram. Okay, so this Woodruff Plexus is present here, somewhat here. So can I tell inferior to the posterior end of the inferior turbinate? Right? Okay, so it is the plexus of the vein present in the inferior to the posterior end of the inferior turbinate. Okay, and this is the very common in the this Woodruff Plexus. Okay, in this what happening if there is any bleeding. Okay, so posterior bleeding. Okay, and blood will then go to the throat. Okay, it's very common in the it's an adult, right? So now we have to discuss about the causes of the epistatic. So so far what we have to see, epistatic means bleeding from the nose. Okay, it's a sign, it's not a disease. Okay, so after that we have to see little area and little area retrocolumnar veins and this Woodruff Plexus. Okay, now causes. What can be the cause? Causes of the epistatic. Okay, causes of the epistatic is divided into 3 parts. One is the local cause, second is the general cause, causes, and third is the idiopathic cause. Okay, so going to see First is the local cause. Local. Second is the general cause. General. And third is the idiopathy. Third is the idiopathy. So talking about local cause. In the local cause, we have to see in the nose and the nasopharynx. In the nose, what we have to see? We have to look for any trauma. We have to look for any trauma. We have to look for any trauma. Trauma, okay. There, what normal trauma? Fingernail trauma. Okay, fingernail trauma may be there. Okay, in the surgical trauma will be there, right? So, and if there is a middle one third, fracture of the middle one third of the face, okay, it also can lead to the trauma. So, these all are the things in the trauma, okay. And after that, what we have to see? After that trauma, we have to see whether there is any inflammations or not. Inflammations, right? Whether there is inflammation or not. It can be acute or it can be the chronic. It can be the chronic. Okay. So, inflammations means I am talking about the infections. Okay. These infections may be the acute or chronic. In the chronic, what kind of the? In the chronic inflammations, you have to remember like disease which form the crust. Okay, so crust forming disease, right? So crust forming disease, what will happen if there is something crust? Okay, what person will think? Person will think there is something. Okay, and he want to remove that. Once he remove that, there will be bleeding. Bleeding will be occurs. Okay, so crust forming disease. Can you tell me some name of the crust forming disease? What we have seen in the if it is your nasal septum, okay, what is here? Perforation, okay, in the perforation what we have to see? If there is a perforation, there will be some crust will be formed, okay. So one thing is the perforation. One thing is the perforation. Second thing is the granulomatous disease, right? So, granulomatous disease. So, granulomatous disease, okay, in the granulomatous disease, and one thing is the atrophic rhinitis. Atrophic rhinitis, yes. Atrophic rhinitis is also a kind of crust forming disease. In the acute form, okay, viral rhinitis. Okay, so viral rhinitis is there. Okay, nasal diphtheria will be there. Okay, so these all are the things. Now, trauma infection we have to cover. Okay, now we have to go to the foreign body. Foreign bodies. Okay, this foreign body can be of two types. Okay, one is the non-living, and one thing is the living. Okay, one thing is the non-living and second is the living. In the non-living, can be any example? Rhinolith. What is the rhinolith? Stone formation in the nasal cavity is called rhinoliths. Okay, so stone formation in the nasal cavity is the rhinolith. So example is the rhinolith is the example. In the living, what will happen? Maggots. Okay, so any maggots. Okay, if there is any leeches, okay, if it's enter into the this nasal cavity, okay, so there may be the bleeding. Okay, so now one thing we have to see trauma, second thing is infection, third thing is the foreign body. Okay, fourth thing I want to write here, right? So any neoplasm, right? It can be the benign and it can be the malignant. It can be the malignant and it can be the benign. Okay, so in benign, what is hemangioma, papilloma, and here is the carcinoma or sarcoma, right? So neoplasm is the benign and the malignant. In the benign, what? Hemangioma, and here is the carcinoma or the sarcoma. Okay, so hemangioma, and you can tell the papilloma is also, right? So these are the things. And one thing you tell me, what we have read in the deviated nasal septum. Deviated nasal septum, there is also bleeding, right? So fourth thing is this. Fifth thing, I think it's visible, right? So fifth thing is the deviated nasal septum. Deviated nasal septum. In this, what happens? Spool. Okay, there is a five. There is a, you know the type of the deviated nasal septum. If there is spool type, am I right? So what will happen? It's giving the spool, giving the pressure on the lateral wall. Okay, and there will be the bleeding occurs. Okay, so this one side. And since condition what? Atmospheric pressures. Okay, atmospheric changes. Right. So in the atmospheric changes, what I mean? If there is any sudden atmospheric changes, okay, it will lead to bleed. Okay, so these all are the causes of. So these all are the causes of the local causes. Okay, now we have to see the causes in the nasopharynx. What will happen? Any malignancy. Okay, if there is any tumors. Okay, so that tumors, malignant tumors. Okay, and there is angiofibroma. Okay, one thing is the angiofibroma. Okay, so these all are the causes in the local causes, right? Now, I want to explain general causes. In the general causes, what all are the general causes that you have to start from the system. Okay, you have to go one by one on the system. First of all, we will talk about the CVS. Okay, after that it's branches or blood. Okay, so blood or vascular disorder, right? After that we will go to the kidney. After that we will go to the this liver, right? So one by one we will see it. Okay, so talking about general causes of the epistatic. General causes, right? So in the general causes, first is the serious cause. Serious. Any problem in the this is serious. Okay, it will lead to cause epistatic. How? If there is hypertension, think if there is hypertension in the old age person, if there is hypertension, okay, hypertension and arteriosclerosis. So what will happen if there is hypertension? Okay, and there is arteriosclerosis. So artery is cannot flexible, right? So he can't. That artery can't tolerate the pressures. So it can be the rupture. Okay, so in the case of the hypertensions, right? So hypertension, okay, and atherosclerosis, right? Atherosclerosis, okay. So these are the certain things in the CVS. Okay. Second thing is the blood, and it's blood and blood vessels disorder. Can you tell me some disorder? Blood. So blood disorder, leukemia. Can you tell leukemia and anemia? Okay, so leukemia, anemia. So these all are the diseases. These all are the disorder of the blood. Okay, so blood, and if there is a blood vessels disorder. Okay, so these things. What will happen if the liver will damage? Okay, so liver disorder. In the liver, what? Fibrosis of the livers will be there, right? So if liver is hepatic damage, if there is hepatic damage, what will happen? Coagulation factor. Second, which one? Second, 7th, 9th, 10th. Okay, these all will synthesized by liver. If liver get damaged, so this will not be there. Yes, this will not be there. Yes, and there is no coagulation mechanism. Okay, and in this blood one you can add a hemophilia is also there. Okay, so this will affect, and there if there is any trauma, okay, so bleeding will be there. What will happen in the case of the kidney? In the kidney, what is there? That is the chronic nephritis. Okay, and drugs. The fifth thing is the drugs. Okay, if you are taking which kind of drugs? Anticoagulants. If you are on anticoagulant therapy, okay, there is anticoagulant therapy is there. Okay, if your patient is on that, so what will happen? There is coagulation mechanism will not be take place. So this will cause. And if you are taking analgesic, okay, if you are taking analgesic, that also will cause to the this bleeding, right? And now one thing is the mediastinal compressions. Okay, so mediastinal compression. What will happen if, for example, here is your heart, this is your heart, and here is your this is your sternum. Okay, mediastinum, you know the anatomy of the mediastinum and everything. Okay, if there is mediastinum compressions, okay, so what will happen? Blood vessels will be compressed. Okay, so venous drainage from the head and neck, okay, it will restrict it. Okay, so there will be problem in the venous drainage. So what will happen? Venous drainage. So venous pressure will be increased in the nose. Okay, so it will lead to the cause bleeding. Okay, so mediastinal compression is this. Now, if there is any acute general infection, so what will happen in the acute general infections? Tell me some acute general infections like whatever we are how to say, like this dengue. Okay, so these all are the what infections. Okay, so in this cases what happening? Also this bleeding will occurs. Okay, so these all are the general causes. Okay, can you tell me some idiopathic causes? Can you tell me some idiopathic causes is what? That is only idiopathic. Okay, there is no cause. That is the idiopathic. Okay, so acute general infection in that like influenza, measles, okay, chicken pox, dengue. Okay, so these all things will come there. Whooping cough, rheumatoid. Okay, so these all things will come there. So these are the causes. Now what we have to see? We have to see the site of leakage. Site of leakage is the very, very important thing. Site of leakage in most of leakage is the from the site of leakage. Okay, so most 90% cases, okay, it's happening in the little area only. Little area only. In the 90% cases, okay. After that, what is CA? This is your, for example, this is your lateral wall. Okay, here is what? Superior terminate. Here is the inferior terminate. Sorry, middle terminate, and here is the inferior terminate. So, bleeding, first thing is the from lateral area. Second thing is from above the level of middle terminate. So, above the level of middle terminate. In the third part, below the level. So, below the level of that middle terminate. Right now, and one cause is profuse bleeding. Okay, so profuse bleeding from where? From nasal septum and the lateral wall. Okay, and one thing is the from nasopharynx. Okay, and posterior part of the nasal cavity. Here is the nasal cavity, and it can be from here posterior part. So that is called posterior epistatics, right? There is two type of epistatics. One is the anterior epistatic and second is the posterior epistatic. In anterior epistatic, what happening? This how to say that difference? Okay, I will tell you. Okay, so these all are the sites. 90% case of the little area above the level of the middle terminus. Okay, from here bleeding. So which artery? Ethmoidal artery. It may be the anterior and the posterior ethmoidal artery, right? Below the level of the mediastinum. Middle terminates. Okay, and the nasopharynx, and from the posterior nasal cavity. These all are the sites. Okay, examiner can ask the sites. Now we have to classify the epistatics. Classification of the epistatics. What is the classification? It's anterior or the posterior. Can you tell me the difference between anterior and the posterior epistatics? It's very simple. Anterior and the posterior. Anterior epistatic and the posterior epistatics. First thing, it is more common. It is more common. Here is the less common. Right. Second thing, common in the infants and younger children. Here is the very common in the old age group. Old age, or you can tell more than 40 years of age. Here, it occurs due to the trauma. Right, mainly due to the trauma, but here is the due to the hypertension and arteriosclerosis. Right. Tell me some other difference. In the anterior epistatics, blood come out from the nose. Okay, so from nose only. What? Blood come out from the nose, but here blood enter into the throat. Here blood will enter into the throat. Am I right? Now, and here in the treatment, in the anterior epistatics, we can manage with normal treatment like first aid. Okay, so first aid. Okay, cold compressions we can give, or picking the nose. Okay, but here hospitalizations, right? And here this is less severe, but this is the more severe. Am I right? So these all are the difference between this anterior and the posterior epistatics. Okay, so age group we have discussed, cause we have to discuss, and the bleeding. Okay, in here is a mild bleeding, and here is the profuse bleeding. Okay, so we want hospitalization. Okay, patient should be hospitalized, right? So these are the classification. Okay, in some books some other classification is also giving, like primary and the secondary classification, right? So primary and the secondary. Okay, only one thing, that is, it is the idiopathic. Right? And this is what? This is due to the hypertension or arteriosclerosis due to this. Okay, in some books it's given like given like children's and in the adult, children epistatic and the adult epistatic. Okay, so what can be the cause? Trauma. Here is the hypertension and arteriosclerosis. Here is the age group is this is children. Okay, so less age group. Here is the more than 40 age group. Okay, here is the what is the most common site? What is the most common site for the children? That is the little area, right? So here is the little area. And can you tell me the most common site? Here is the Woodruff Plexus. Okay, what is the most common cause? Here is the in the children most common cause, that is the idiopathic, or you can tell the trauma and health. But in the adults, what is their hypertension? Okay, so hypertension and all is here. Okay, so these all are the classification. But in Dhingra book, it's giving the anterior and the posterior epistatic. Okay, you remember this. Okay, if you go through that is also nice. Okay, so these all are the classification. Okay, now treatment, management. How we have to do? How we will manage the patient? If a patient with the epistatics, first of all we have to do first aid. We have to give first aid. Okay, so management. In the management, okay, in the management first thing is first aid. In the first aid, what we have to do? If a patient with the epistatics, okay, we have to picking the nose. Okay, not packing, picking. Okay, so picking the nose. So picking the nose for only for 5 minutes. Okay, so what will happen if there is bleeding? So what will happen? We have to pick the nose, right? So up to the 5 minutes. So coagulation reaction will be active, and there will be the clot will be formed. Okay, and bleeding will be stopped. So it is for 5 minutes. Okay, and we have to give cold compression. and you tell me when we are picking the nose, okay, then actually what we are doing? We are compressing the vessels. Okay, so bleeding will be stopped. And in the cold compression, what happening? Vasoconstriction will be occurs. Vasoconstriction will be there. Okay, so what will happen if you put ice? Okay, so it is a cold compression, so there will be the vasoconstriction. Okay, so vessel will constrict and bleeding will stop, right? So this is the first step. If it is not controlled by the first step, what we have to do? We have to cauterizations. Okay, so when we have to do this cauterizations, when first aid is not effectively, when it's not effectively, and we have to cauterize the vessels. In this, we have to do this when a bleeding point has been located. Okay, we know from where bleeding is occurring. If bleeding point is located, okay, then only we can do, right? So if the bleeding point is located, we have to do this cauterizations. Okay, now if it is not effective, what we have to do? We have to go with the anterior packing, and there is one thing that is called posterior packing. Okay, now you have to understand one thing very well. Okay, see here, come here. Normal things what I am drawing here, just one small diagram. Okay, so this is your lateral wall of the nose. Am I right? This is C. You just think. Now I am here, okay, and you are cutting me from here, and you are seeing from the lateral view. Am I right? You are seeing from the lateral view. So it will be like this. Okay, but during management, what we have to do? We have to take patient in the supine position, right? So I am drawing this in supine position like this. Okay, so it will be go like here and here. Okay, so see here. It will be like this. Am I right? It will be like this. This is normal condition. Okay, where I am standing, and this is the lateral view. But here in the supine position, right? So what we are doing in the anterior packing? Listen very carefully. In the anterior packing, we want when ribbon goes. Okay, 1 meter for each nasal cavity. For 1 meter for each nasal cavity, and it shocked with paraffin. Am I right? Paraffin. After that, what we have to do? See here. This I want to remove. Now 1 meter for each cavity, each nasal cavity. So it is like this. 1 meter, right? Here is first part. Now there is one instrument. Okay, in that instrument is like this. Okay, for suppose this is your instrument. So what you are going to do? You are taking this ribbon goes part inside here. Okay, you are inserting here in this line. Okay, after that what you will do? You will remove this, and from here you will take some part of the ribbon goes, and you will put here. After that you will take from here part, and you will put like here. After that from here it will go like this only, right? So what you are doing, that 1 meter ribbon goes, no, you are putting in the nasal cavity. Am I right? Yes. So it is like this and this. Now you tell me if this diagram is like this. If this diagram is like this, right? So now it is like this. So it will be like this, like this. Okay, this layer will be like this. So that is called horizontal packing. Am I right? That is called horizontal packing. In the anterior packing, there is 2 type of packing. One is the horizontal packing, and the second thing is the vertical packing. And in few cases, what happening? in the few cases what happening, same things, it is like this, from here it's going like this and this. Here is the ribbon goes, this is the ribbon. Okay, now in the with help of the instrument what doing, it is inserted here, filling first this part, after that second layer is here, third layer is here, fourth layer is here, like this. Okay, so when it will come like this, it will be like this, it will be like this, and that is called what? Vertical packing. Okay, once it is inserted, after that what? We have to put tap here. Okay, and its packing has over. So this is how we have to do it, anterior packing and the anterior packing, okay, vertical and horizontal. In the posterior packing, when we have to do posterior packing, when there is the bleeding from the posterior sides. Okay, posterior epistatic. In the case of posterior epistatic, we have to do posterior packing. In that, what happening actually in this, we are using some things. Okay, and we are inserting in the from the nose. Okay, one end will from the nose and it will come out from the from mouth. Okay, and it will be inserted into the that part in the pharynx. Right, it will be inserted there. So this is the posterior packing. If it is not controlled by anterior packing and the posterior packing, then what we have to do, we have to go with one more things, and that is called sorry, this is I want to remove this. Okay, so now we will do the endoscopic quantizations. Okay, so next thing is the endoscopic quantizations. Endoscopic quantization. First we have seen the quantization. Now again this quantization. Now endoscopic quantization. Okay, if there is bleeding point has located, if you know the bleeding point, okay, we have to do this endoscopic quantizations, right? But in the profuse bleeding, if there is profuse bleeding, okay, we can't do this endoscopic quantization because point we can't locate it, no, so we can't do this endoscopic quantization. Now next thing is that is our SMR, our favorite SMR. Okay, submucosal resection operation. Okay, why we are doing this? See, in the case of deviated nasal septum, okay, so there won't be like spool. Okay, spool is there. Okay, and here is the lateral wall. So it's piercing, not piercing. It's giving pressure on the lateral wall. Okay, and bleeding is occurs. So for removing this spool, okay, we are doing this SMR. One thing. Second thing, why we are doing this SMR? In the SMR, we are just elevate the flap of the mucoperichondrial flap, okay, and reposition it. So what it will lead? It will lead to the fibrosis. It will lead to the fibrosis. Okay, so their fibrosis will be occurs. Okay, and this thickness will be increased. So what will happen? Vessels will be compressed. Okay, compressions of the vessels will occur, and it lead to cause stop bleedings, right? So fibrosis and the spool. For this only we are doing this SMR. Next surgery is that is called ligation of vessels. Now, if you want to ligate, okay, then you have to know the artery supply of the nasal septum and the lateral wall. So can I ligate? First thing is the external carotid artery, because the external carotid artery is giving branch to the branch maxillary artery, and one is the facial artery. From there, branches going in the supplying. So we have to ligate this external carotid artery just above the origin of the superior thyroid artery. Okay, from here, this thing very important. Just above the origin of superior thyroid artery. Okay, if see there's a common carotid artery and external carotid artery, internal carotid artery. If we just ligate this near the origin of the external carotid artery, what will happen? Artery supply of the thyroid gland, it will be stopped. Superior thyroid artery supplying the thyroid gland. Okay, so it will be stopped. Okay, there will be restriction. Okay, so what will happen? This there will be problem in the thyroid, right? So we are avoiding that and we are doing just above this. Okay, so there is some more branches also. Okay, so this superior, how to tell, superficial temporal artery, okay, maxillary artery, there is so many branches, right? So nowadays we are not doing this external carotid artery ligation, we are not doing this. Okay, what we are doing more ligation of the more peripheral branches of the sphenopalatine artery. Okay, so sphenopalatine artery branches we can do that. Okay, now the second thing is the ligation of the maxillary artery. Maxillary artery. Ligation of the maxillary artery. Okay, if there is a posterior epistatics, and it's not controlled by this conservative methods, okay, then only we have to do this maxillary artery ligations. So posterior bleeding will be stopped. Next thing is that is called ethmoidal artery ligation. And you know ethmoidal artery is supplying where? Here is your nose, right? This is your nose. This is your nasal septum. For example, this is your nasal septum. So it's supplying here, anterior ethmoidal and the posterior ethmoidal, right, in this region, and posterior is supplying only up to this. Okay, so what we have to do? We have to this ethmoidal artery, anterior and posterior ethmoidal artery, we have to ligate that. Okay, so this is the ligation. Next thing is the next one thing, that is called taspal. Taspal, yes. Taspal. What is the taspal? Sphenopalatine artery ligation. Taspal means transnasal endoscopic sphenopalatine artery ligation. Okay, so what we have to do in these conditions, we have to just elevate the mucus part. Mucus part in the, there is one flap, okay, mucus flap, okay. So in the mucosal flap, we have to elevate in the lateral wall, and that is in the posterior side. Okay, so posterior part of lateral surface, we have to elevate that, and we have to identify the sphenopalatine artery, and we have to ligate this. Okay, so this is what, this is the transnasal endoscopic sphenopalatine artery. Okay, so this is taspal. This is the taspal things. Okay, so these all are the treatments. Okay, so these all are the treatment. Okay, how after that what we have to do? We have to check the blood traces and all of the patient. Okay, the blood traces and everything we have to check. Okay, so these all are the therapy. First aid, quantizations, anterior endoscopy, posterior and anterior packing, posterior packing, right? And one thing is one thing I want to explain, that anterior in the anterior packing we have to kept only for 24 hours, but in some cases we have to kept it 2 to 3 days. Okay, 2 to 3 days. In that condition, we have to use what? So antibiotics also we have to use. Antibiotics we have to use. Okay, systemic antibiotic we have to give to prevent it. Sinus infections. Okay, there is sinus. So sinus infection we want to prevent that. That's why we are giving this antibiotics. Okay, so this over, and artery ligation is over. See, epithelial artery, no, epithelial artery is supplying there. Okay, so we are ligating this artery and the maxillary artery and everything. I think I have covered everything. Okay, so you should be thorough with the Epistatis. Okay, thank you.